Whistleblower Dr. Li Wenliang said that the Chinese government knew that human-to-human transmission was taking place weeks before they told the public what was happening. Christian Anderson, an evolutionary biologist at the Scripps Research Institute, has estimated that the virus could have infected its first victim as far back as October 1st, based on a study of 27 genomes from early patients. This means that the virus was spreading all over Wuhan, and the world, for the past few months. If this research is correct, that means that this virus had likely made its way to every corner of the world by the time the Chinese government decided to shut down Wuhan. This may sound like an exaggeration because we are just now finally starting to see some confirmed cases in the United States and Europe, but let's take a minute to examine what a confirmed case actually is. A confirmed case is a person who has tested positive for the virus, but the number of test kits is limited and the CDC has refused to authorize test kits for many of the suspected cases because they are keeping such strict criteria for who the test gets sent to. Making matters even worse is the fact that some of the tests have been shown to be faulty, and officials admitted that one of the facilities that was tasked with analyzing the tests was contaminated. Testing has begun to accelerate in the United States and Europe, now that deaths have been reported, and health experts are beginning to find clusters of the virus with no clear link to the epicenter, meaning that community spread has already begun. In Seattle, which is looking like one of the first epicenters in the US, experts believe that the virus has been spreading silently amongst the population for at least 6 weeks. This type of silent spread is possible due to the massive incubation period of the virus. Some studies have suggested that the time of incubation for this new virus could be up to 24 or even 27 days, meaning that an infected patient could be walking around for a month infecting other people without even knowing that they are sick, which greatly increases the pathogen's ability to spread undetected. Compare this with the incubation period for the flu, which is 1 to 4 days. Speaking of the flu, the coronavirus outbreak may have gone undetected for these first few months because it was being mistaken for an especially bad influenza season. In Washington, where we now know there has been an active coronavirus outbreak for months, the State Department of Health recently published some interesting statistics about hospital visits for flu-like symptoms. The charts below show how this year there has been an unusual number of people who experienced flu-like symptoms but did not test positive for the flu. Figure 9 shows the percentage of people who tested positive for influenza, while Figure 10 shows the percentage of influenza-like illness, ELI, cases where there was a negative result on the flu test. Figure 9 shows a relatively normal flu season.